But without further ado, I'd like to hand over to, they've told me to introduce them as the commissioners, because actually they all have very long kind of titles, which I couldn't remember at this point in the day. But please welcome, I've got Kate Alcock, Head Commissioner with Council, Adult Social Care, Peter, who's a strategic lead, and Stuart Cohen, who everybody knows, who I work with for a number of kind of years in kind of commissioning with dementia, who is the deputy lead for
Adult Mental Health, Learning Disability and Autism. Adult
Mental Health, Learning Disability, Autism and Dementia, and Older Adults Mental Health. So I will hand over. It's great that they've come here today to talk about new services, what's kind of hot and what's in the pipeline.
Can everybody hear me okay? They don't usually let me loose on a microphone, but it's nice to see you. Thank you so much for inviting us today to talk to you a little bit about our new carer strategy and the new carer service delivery model. I did talk to Paul about whether he'd done a risk assessment about allowing the commissioners to come on after the lunch in the sleepy bit. We perhaps should have had our new friends from Maid on at this bit so that we don't all fall asleep. But we'll do our very best to keep you entertained, and we've got a little activity. So we're going to talk for about 10 minutes about the new strategy, and then you'll see a little activity on the table which Pete is going to introduce to you. We thought we'd get everybody talking in the after lunch shift so you don't all fall asleep listening to the commissioners. I wanted to start with acknowledging all the people in the room who have been part of our carers and dementia services over the last 5 years or so. There's quite a number of people in the room who have historically been employed by those services, largely provided by the voluntary and community sector. So can I just ask you all to help with me thank those people by giving a little round of applause for our carers and dementia services. Thank you. When we come to the end of contracts, some of these contracts have been in place for about 5 years now, so when we come to the end of our contracts, we sometimes have to say goodbye to some of our service providers as new contracts come in place and we take over. So it's always a bit of a strange time for us in terms of saying goodbye to some of those services and welcoming new ones, but we've got some exciting things to talk to you about today. So I think I've got a button, yes, great, thank you. So what we wanted to talk to you about today is our new carer strategy, Caring in Cornwall. We're really excited about this strategy. It was a co-produced piece of work with people with lived experience of caring in Cornwall. So we had about 800 carers who shared their views with us in the creation of the strategy, and hopefully you've all seen a little copy of that on your tables, and if you wanted to take some time to have a look at that over the next few moments, you'd be really welcome to do that. So we wanted to talk to carers from lots of different age groups and different backgrounds to make sure that we were talking to as many carers as possible, but also those carers who are sometimes a bit harder to reach. And carers told us they felt really listened to and that their views had made a difference. So the strategy that's in front of you is something that we wrote together with the carers, and they told us that they felt really represented in the way that the strategy was developed over time. So just to give you a little bit of context, we've got about 5.8 million unpaid carers in our country, with about 50,000 in Cornwall, at least 50,000 in Cornwall. Those are the ones we kind of know about, but there are lots of carers who perhaps unknown about at the moment or who don't see themselves as carers. And what we know is that nationally that provides about £184 billion worth of gross value added. And in Cornwall that's about £1.6 billion a year of additional value that unpaid carers bring to our economy. So an amazing wealth of experience, but also something that we really can't live without. So we're really grateful to unpaid carers for all the work they do for us and to support people that they love. So that's been it's really important to understand some of those figures and understand the size of the problem that we are trying to support solutions for. In terms of the impact, everybody in this room will be very well aware of the impact that carers have, but also the impact that caring has on carers. So we know that it affects people's mental and emotional well-being, their physical health. It has a huge economic impact for carers, social impact, being able to get out and see your friends and family and to reduce loneliness and isolation. And also there are in policy and support gaps that we need to make sure we're addressing as the commissioners of the services. So the strategy identifies 4 priorities. These are the priorities that were closest to the hearts of the carers that we spoke to, and that they were really important to them in making sure that when the commissioners are thinking about how to commission services for carers, we're really understanding what is most important to carers with lived experience. So priority number 1 is around making sure that carers have timely access to information. Priority number 2 is around making sure that carers have access to help, support and activities to enable them to live the life they want. Priority 3 is around carers making sure that they're supported when they need us the most, making sure that we're addressing the challenges and gaps in the current system. And priority 4 is around making sure that carers feel heard, that they're recognised and appreciated and valued. So in the next few months, we're going to be doing a big piece of work looking at a carers charter, and that charter will be sort of setting out what we all expect from ourselves when we're working with carers and what they expect from us. So making sure that people who are supporting carers really understand what's important to them, and that we're communicating effectively and treating carers like they're experts in the care of the person that they support. So that one came out really strongly from the carers that we worked on with the strategy. How will we know we've made a difference is really important. So one of the things that carers wanted us to make sure was included in the strategy is how will we know we're having an impact. So every 2 years we do a big survey. It's part of a big national survey that happens for carers, where we ask carers about the quality of life. It's something we know that in Cornwall we're not doing great at, and we want to make sure we do better at in the future. So a lot of the services that have been commissioned under the strategy are about how we make sure that carers have got improved access to quality of life. We also want to make sure that we are increasing access to timely carers assessments as well, something else that carers told us was really important. At the moment, it does take a bit of a while to get access to a carers assessment, but also to access funds that come as a direct consequence of that assessment. So that's something we're definitely focusing on in the new delivery model. We also want to make sure we have a reduction in complaints. We do receive complaints for carers who have not been able to access timely support, and so that's something we want to make sure we're measuring when we're looking at impact. And we also want to make sure carers have access to short breaks and leisure activities. So again, that was something that carers fed back to us was really important. So part of our measurement of the performance of the new services will be specifically looking at how carers access a break and other activities. So all of those things are really important to us in measuring how we are understanding the success of the new services that are being commissioned under the strategy. The new approach to the service delivery model, as it is at the moment, is very focused on prevent, reduce and delay, which are our statutory requirements under the Care Act. So as a local authority, we've got a set of duties that we're expected to meet as part of the delivery of services for carers, and those come in those different layers of prevent, reduce and delay. So part of prevent is about making sure we're identifying carers as early as possible, that we're reducing the pressures on carers as part of their day-to-day activities by finding ways to provide practical help and support for them, and then delaying and preventing the need for additional sort of more formal support services where carers might need to access a carers assessment or emergency short breaks, those sorts of things. So we're trying to prevent and reduce, but when people get to a point where we might need to delay their loved one going into a care home for all those sorts of things, that we are doing everything we can to support those carers to allow the person they love to stay at home for as long as possible. And finally, preventative approach. This is what our service delivery model looks like. So there's an emphasis on community support. So as part of the new delivery model for carers, we've got a pot of grant money that can be used by the carer services to help to support local community groups or ideas that communities have got to support carers differently. So there's a pot of grant money that will be available in order to be able to do that in future. Then we've got our core carer service. So at the moment, our carer service is designed so that it's quite centralised. It's sort of one service that operates across Cornwall. And what we want to do, based on the feedback we have from carers, is to think about how we make those support services more place-based, so that carers support staff are in the places where carers live in their local communities. So a big part of the new delivery model is about having a whole family approach and making sure that we're supporting carers of all age groups, but also that those carer support services are really in the communities where people live. And then in addition to that, we've got a number of carer specialist support services, and Stuart's going to talk a little bit about the one that we've got specifically for carers of people living with dementia. So there's a number of those specialist services, one around young carer support, one around parent carer support, one around mental health carer support, and one around specialist dementia. So the specialist dementia services Stuart will describe in a minute. we'll be looking at support for people living with dementia, but also for their carers as well. So this is what our new service delivery model looks like. We're really excited. It's a really great opportunity to respond to the specific needs that carers have identified and communicated to us. And we are really pleased to be able to listen to what they've told us and make sure we've got commissioned services that really are fit for purpose for the future. So I'm going to hand over to Stuart now, who's going to talk about the specialist dementia service. Thanks, Stuart.
Thank you. I was organised enough to type up my notes, but then forgot my glasses, so if you see me squinting, apologies. Right, so specialist dementia. Now, I think most people here might have seen us when we presented about the dementia strategy in the past, and obviously our carer strategy is a joint strategy with both health, social care, so is our dementia one. They do work together, and one has been used to inform the other and vice versa in its development. So a lot of the feedback from carers and carers of people living with dementia was around the support that could be offered, and we've had presentations earlier in the day, and one of them was about timeliness, and I seem to remember the slide particularly about end of life and when bereavement support comes in, and it had a timescale that goes on, and that's pretty much how diagnostic or pre-diagnostic and post-diagnostic support comes in. It's about finding the right time to deliver that support. So it isn't always right that it's delivered right at the point of the diagnosis, because sometimes it's a lot of information to absorb. So it's about finding that right time, that right point of delivery. But we've got a big growing demand for people living with dementia. Alison talked earlier about the nearly 6,500 in Cornwall, out of an expected 10,000, which is about 2,000 more people than it was when we started this work in 2018. It's growing a lot. But by 2030, that expected 10,000 is going to be closer to 15,000. So the more we can do to support people earlier, the better. We already know that figure. So Kate mentioned the carers procurement and the carer service, and what we're looking to deliver. And within that, we've got dementia advisors and dementia nurses. So this is about embedding a lot of the good practice, a lot of the good work that we already started delivering, and bringing it alongside the carer service. So the way I try to explain this is, why are we sending two people up the garden path when actually you're seeing the person, you're there, you've got the skills, you're already doing a lot of this, and it's about doing that right support at the right time, when it's needed, because it's not always the right time at the point of diagnosis. So there are more forms of support than this, and I talked about the dementia advisors and dementia nurses, and I talked about them as sort of kind of post-diagnostic. There are still other forms of support, because not everyone will seek a diagnosis, not everyone needs the support we're talking about from dementia advisors, but there are lots of other forms of support, like the memory cafes. We have a really strong memory cafe network. We have really good VCSE organisations. There is a wide network of support, so we don't ever want to close the door for services on the basis you don't have a diagnosis. But obviously having a diagnosis is really important, because it helps us to plan, design services, and work out what we're going to deliver and where. So I do have one more ask, before we go on to the final. I have one more ask while we're here today, and that's where carers are identified. We as commissioners and NHS organisations, council organisations, we need to know where people are. We've already got a carers register that sits within our carers service. We've got the census that told us there were 55,000 carers in Cornwall. We know that the number's bigger than that. But if I look at GP records, I've got like 800 carers registered on GP records. there is a field for it. And the more I can get that information onto GP systems, the more it helps build a picture where people living with dementia are and their carers. So if there's one ask that I've got today is trying to encourage people who are carers to get registered as a carer on their GP system. Thank you. It's 10 minutes left. So I will move on to Pete now, who's going to have a little... Well, I give it away with the next slide, but here it is.
I only normally get to speak in front of this many people at a pub quiz, so forgive me if I stumble. They tend to be a different type of audience. Hopefully on your tables you've got a couple of sheets with sort of a one-page profile of different types of individuals that might access the carers service, especially the dementia part of the carers service. We've also put out a few physical copies of the carers strategy. Firstly with those, if anyone wants to take them away with you, please feel free. I've got a few more knocking around on our table that I can share as well if anybody else needs them. What we're asking you to do with the one-page profiles is you've got sort of 4 boxes representing each of the 4 priorities on the screen. And we're just asking you to use the rest of the time up till about 2 o'clock to consider what might be the barriers for each of these individuals in accessing the service, how the service might support them to ensure they've got timely access in the ways that fit their specific profiles and experiences, and just kind of work through each of the 4 priorities in that kind of vein. As I say, the service will be going live fairly soon, so what we're hoping to take away are some things that we can use to kind of shape the service and shape the delivery, so that it kind of gets off the ground and gets flying as quickly as possible, essentially. We've also got a post box on our table if anybody's got any sort of particular comments or thoughts or ideas that they want to share with us. Full disclosure, I forgot the post-it notes that's supposed to go in the post box, so if anyone's just got like a scrap of paper or I can rip some papers out of my notebook, then just come and give us a shout on our little table at the back there. But other than that, I think you've got probably just a hair under 10 minutes to have a look at the profiles and see what comes to mind for each of the 4 priorities. Cheers.